Cervical cancer is an oncological disease. Look at this picture, shows that uterus, cervix, cancerous tissues, and MRI findings. Look at this. PET and CT findings. Look at this. Detail going on. Introduction. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is primarily linked to persistent infection with high risk strains of human papilloma virus HPV. Screening and early detection have significantly improved outcomes. Yet cervical cancer remains a significant health concern, especially in low resource areas. Definition. Cervical cancer is defined as the uncontrolled growth of abnormal cells in the cervix. These cancerous cells may spread metastasis to nearby tissues and other parts of the body. If not detected and treated early. Types. 1. Squamous cell carcinoma. The most common type, accounting for about 80 to 90% of cases. It originates in the thin, flat cells lining the cervix. 2. Adenocarcinoma arises from glandular cells in the cervix, contributing to 10 to 20% of cases. 3. Adenosquamous mixed carcinoma contains both squamous and glandular cancer cells and is rare. 4. Small cell neuroendocrine carcinoma, a very rare and aggressive type of cervical cancer. Causes. The main cause of cervical cancer is persistent infection with high risk of HPV types, particularly HPV 16 and HPV 18. Additional factors include smoking, immunocompromised states, example HIV infection, long-term use of oral contraceptives, and early sexual activity. These main causes of cervical cancer include 1. Human papilloma virus infection. 2. Smoking damages cervical cells. 3. Weakened immune system. 4. Long-term use of oral contraceptives. 5. Multiple full-term pregnancies. Risk factors. 1. HPV infection, the strongest risk factor to multiple sexual partners, increases the likelihood of HPV exposure. 3. Smoking damages cervical cells and weakens immune response to HPV. 4. Immunosuppression, higher susceptibility, especially in HIV positive women. 5. Early sexual activity increases risk of HPV infection. 6. Long-term use of oral contraceptives associated with a slightly increased risk. 7. Multiple pregnancies, high priority has been likelihood greater risk. Complications. 1. Spread to other organs, can metastasis to nearby tissues, lymph nodes and distant organs. 2. Infertility as a result of radical treatments affecting reproductive organs. 3. Urinary and bowel complications, cancer spread or surgery can impact nearby organs. 4. Psychological impact, anxiety, depression and emotional distress. Pathophysiology. Cervical cancer typically develops from a pre-invasive phase called cervical intraepithelial neoplasia (CIN), where abnormal cells are confined to be cervical epithelium. Persistent HPV infection triggers oncogenic processes through E6 and E7 viral proteins which inhibit tumor suppressor genes like P53 and RB, allowing cells to proliferate uncontrollably. Over time, these dysplastic cells can invade deeper cervical tissues, becoming invasive cancer. The cervical cancer step-by-step pathophysiology. 1. HPV infection. 2. Viral entry and integration. 3. Expression of viral oncoproteins E6 and E7. 4. Inhibition of apoptosis and uncontrolled cell growth. 5. Development of cervical intraepithelial neoplasia (CIN), the abnormal growth and accumulation of mutated cells result in CAN. Precancerous condition, CAN is classified by severity. First, CAN 1, mild dysplasia, lower grade lesion confined to the lower third of the epithelium. CAN 2, mediated dysplasia, involves a lower two-thirds of the epithelium. CAN 3, severe dysplasia or carcinoma in situ, affects the full thickness of the epithelium but has not yet invaded the underlying tissue. 6. Progression to invasive cancer. 7. Angiogenesis. 8. Metastasis. In advanced stages, cervical cancer cells can enter the lymphatic system or bloodstream, spreading to distant organs such as the liver, lungs, and bones, resulting in metastatic disease. This multi-step process of infection cellular transformation, uncontrolled proliferation, and eventual spread outlines the progression from HBV infection to invasive cervical cancer. Signs and symptoms. 1. Early stages, often asymptomatic, detected through screening. B. Advanced stages. 1. Abnormal vaginal bleeding, example post-coital bleeding. Intermenstrual bleeding. 2. Unusual vaginal discharge, possibly blood tinct. 3. Pelvic pain or pain during intercourse, urinary or bowel symptoms in advanced cases. Diagnosis. 1. Pap smear or pap test, screening tool to detect abnormal cells. 2. HBV DNA test, detect high risk HBV strains. 3. Colposcopy allows visible examination of the cervix. Abnormal areas can be biopsied. 4. Biopsy. Confirmatory diagnosis by examining cervical tissue under a microscope. 4. Imaging studies, MRI, CT, PET scans, evaluate the extent of cancer spread. Nursing diagnosis. 1. Acute pain related to cancerous growth or treatment. 2. Anxiety related to diagnosis and prognosis. 3. Risk for infection related to compromised immune status. 4. Risk for impaired skin integrity related to radiation therapy. 5. Body image disturbance related to physical changes post treatment. Management. First, medical management. 1. Surgical options. Colonization for a very early stage cancer. Hysterectomy, removal of the uterus and cervix. 2. Radical hysterectomy, invasive cases, removal of uterus, cervix, part of the vagina and surrounding tissue. C. Radiation therapy, often combined with chemotherapy for advanced stages. D. Chemotherapy, used for more advanced cases or in conjunction with radiation. E. Targeted therapy, drugs targeting specific molecules involved in cancer growth like bevacizumab. Nursing management. 1. Pain management, administer allergies and educate on non-pharmacological pain relief. 2. Psychological support, provide counseling, connect with support groups and encourage open communication. 3. Patient education, inform about treatment options, side effects and the importance of follow-up care. 4. Infection prevention, implement infection control measures and educate on signs of infection. Treatment options. 1. Surgical treatment, depends on stage, can range from localized surgery to radical procedures. 2. Radiation, often used with chemotherapy, external beam radiation or brachytherapy. 3. Chemotherapy, commonly used drugs include cisplatin and paclitaxel. 4. Immunotherapy, encouraging treatments aimed to strengthen the immune response against cancer. Psychosocial medicine. The diagnosis of cervical cancer can lead to anxiety, depression and concerns about body image, sexuality and fertility. Psychosocial support is crucial. Counseling and support groups can help patients cope with the emotional and mental stress of diagnosis and treatment. Here are key interventions often incorporated into social medicine for cervical cancer care. 1. Psychological counseling and therapy. 2. Support groups. 3. Palliative care services. 4. Financial and legal assistance programs. 5. Rehabilitation and survivorship programs. These supportive services play a crucial role in the comprehensive management of cervical cancer, addressing the patient's psychosocial and practical needs alongside medical treatment. Prevention. 1. HPV vaccination prevents infections by the most common cancer causing strains HPV 16 and HPV 18. 2. Regular screening, pap tests and HPV tests help detect precancerous changes early. 3. Safe sex practices using condoms and reducing the number of sexual partners. 4. Avoid smoking reduces risk by eliminating a known cofactor in cervical cancer development. In conclusion, cervical cancer is preventable through vaccination, regular screening, and early treatment of precancerous conditions. With early detection and proper medical and nursing management, outcomes for cervical cancer can be significantly improved, especially in areas where HPV vaccination and screening are accessible. Continuous education, awareness, and advancements in screening are essential in the ongoing fight against cervical cancer. Thank you. Have a nice day.